Another interesting edition of your favorite health program on television, Health Affair. It is a platform where we focus on public health challenges, issues about women and children, providing lasting solutions. I am your regular anchor, Ushuomowa Danis, and you are welcome. We are focusing on stillbirth this week, an enormous yet overlooked tragedy. It promises to be very interesting, so stay tuned as we take you through our news segment. The Arise third free COVID-19 vaccination exercise held on February 9, 2022 at the incubator in Victoria Island, Lagos, Nigeria, with a large turnout of people.
Medical experts advise us to take all the doses, so I think it's simple wisdom to just take it, to be safe. We all grew up taking vaccines. It's because this pandemic happened in our lifetime. When we were all babies and young children, we took measles, we took polio, we took all sorts of things. So the pandemic is new. The medical experts have introduced the vaccine, saying that they will protect us, they will help us. So why not? I don't think we have anything to lose. I think it's a bit more dangerous when you don't take it.
I'm here to come and take the booster dose of the vaccine. It's something that is new to everybody. So when they say the vaccine is going to work, we just have to believe that it will work. Even if you have taken the first and second dose, it doesn't prevent you catching it the second time. Even if you have been in isolation center, you still have to take caution. You have to be very cautious. You have to ensure that you wear your nose mask, you wash your hands every time and everything to prevent, because prevention is better than cure.
Actually taking my first and second was AstraZeneca, and then the booster today, Pfizer. Apparently it's supposed to be like that. You take first 2 doses and then a different dose as a booster. So it's not the same one that you take.
Well, I think what they've done here is okay. I mean, in terms of planning, in terms of the logistics, everything is quite on point here. They give numbers and you sit down, they call you by your number, you just go and they attend to you. It's quite easy.
Everything went smoothly except for a few persons who could not get their doses due to the scarcity of Moderna vaccine. To find a lasting solution to such challenges, some advised on the need for local vaccine production to ensure self-sufficiency.
As a country, it is always good to take up the responsibility of taking care of your citizens. So it will be good if, as a country, we can produce our own vaccines and stop being dependent on what the people outside send to us.
The COVID-19 vaccination exercise by the Arise Foundation is one of the many initiatives by Dr. Shijulu to improve human lives. Beyond the COVID-19 pandemic and vaccination, they urged Nigerians to make preventive health care and regular checkup a way of life for the detection of diseases so as to improve on life expectancy.
What you eat, what you ingest into your system, they are very important. Take your vitamins, eat right, take a lot of water, take a lot of vegetables, because you cannot continue to say swallow, swallow, swallow. You can get swallowed in it, because livers, the kidneys, the organs and all the rest, they do not give respect to any swallow. If you swallow that, you are on your own.
Learn to take care of yourself, learn to make health priority, learn to prevent things before they happen. If it's to take a vaccine, please do it. If it's to check your blood pressure, please do it. If it's to take certain medications to prevent you from coming out with something, please do it. We should have that attitude of being proactive and not allowing things happen to us before we react. So today, this gathering, all we're encouraging Nigerians, we're using vaccine to tell you that you need to think about taking care of yourself. There is COVID now. We don't know what else will surface. There's so many illnesses that are vaccine preventable, especially in our children. And we have seen that the mortality with children for things that are vaccine preventable have reduced. So I really wonder and think why the resistance, but everybody is entitled to their opinion. But look over the years, vaccines have helped us. COVID is not different. So we encourage everybody, to take vaccines.
Aiming to increase access to recommended treatments for COVID-19, the World Health Organization added tocilizumab to its list of pre-qualified treatments for COVID-19. Tocilizumab has been shown, according to clinical studies, to reduce death in certain patients with COVID-19 who are severely ill, rapidly deteriorating, and have increasing oxygen needs. WHO recommended tocilizumab only for patients diagnosed with severe or critical COVID-19, and it is to be administered by a healthcare worker in a monitored clinical setting. The Lagos State government has received a donation of 8 new mobile intensive care unit ambulances and a well-equipped mobile clinical truck from 2 donor partners, Global Fund and Mobile Telephone Network (MTN), for the improvement of emergency medical services and provision of primary healthcare services in Lagos. The Commissioner for Health, Akin Abayomi, noted that the state government has continued to enjoy support from its development partners, donor agencies, and others who at various times have offered help in the state government's drive to provide efficient, accessible, and equitable health services to the citizens. He added that the 8 ambulances will be added to the fleet of ambulances in the Lagos State Ambulance Service. A federal high court in Awka has sentenced a middle-aged man, Ewedu Friday, to 7 years imprisonment without an option of fine for endangering lives of innocent consumers through circulation of fake and counterfeited drugs. Operatives of the National Agency for Food and Drug Administration and Control (NAFDAC) recovered packs of falsified Maldox, a brand of anti-malaria tablet manufactured by a registered Nigerian pharmaceutical company. The convict, who claimed that he had been in the business of adulterating and falsifying medicine for more than a year, confessed that he cut Emzor paracetamol tablets and repackaged them as Maldox. The Director General NAFDAC, Mojisola Adeyeye, while commending the judiciary for rising to the occasion, said the agency would not rest until all still involved in this dangerous business are brought to book. In response to the recent rise in measles cases in Afghanistan, the World Health Organization and partners are strengthening measles surveillance capacities and providing technical support for lab testing, case management, risk communication, and outbreak response immunization campaigns. The WHO also intends to provide children with vitamin A to help reduce sickness and death from measles. They're equally helping to plan for a larger measles outbreak response immunization campaign, which will start in May with the aim to reach more than 3 million children. They're equally helping to plan for a larger measles outbreak response immunization campaign, which will start in May with the aim to reach more than 3 million children.
Female genital mutilation, according to various definitions by health experts, refers to the partial or complete removal of the external female genitalia or clitoris. It is usually done between infancy and the age of 15. Adult women may also undergo the procedure. The practice is said to have started before the advent of either Christianity or Islam. The clitoris being the most sensitive part of a woman's body and the main cause of her sexual pleasure, many argue that female genital mutilation prevents a woman from being promiscuous or loose sexually. According to the World Health Organization and UNICEF, over 200 million females have experienced some form of female genital mutilation. In Africa alone, it was believed that approximately 92 million girls aged 10 years have undergone the procedure. Approximately 3 million girls in Africa are thought to undergo female genital mutilation each year. In Nigeria, 27% of women between age 15 to 49 were victims of female genital mutilation as at 2012. The United Nations adopted a resolution in 2012 to ban female genital mutilation worldwide. Yet, a recent report by UNICEF rated Nigeria third highest country still practicing it. It is to find a lasting solution to this problem that this sensitization program, #Don'tQuoteHer, #EndFGM, was put together by some advocates in the Ikorodu area of Lagos State.
The occasion of the commemoration of the Zero Tolerance Day against female genital mutilation was on the 6th of February, and at this event you realize that across the world the United Nations set it aside so that we can put in concerted effort towards ending female genital mutilation. It's a sustainable development goal as well, and you find that one of the worrisome things for this year is UNICEF coming out to say that Nigeria is now amongst, I think, the third highest, not even amongst, Nigeria is now the third highest nation in the world with the incidences of female genital mutilation. It is disturbing. We used to do a slightly better, but indeed because of the drop and all of that, you then realize that it is time for every hand to be on deck to ensure that all of us are able to put heads together to fight and stop the scourge. This practice, which is highly cultural, which is highly patriarchal in nature, has eaten so deep to the intent that people now claim to say, oh yeah, we've heard this, we won't do it. But actually they go ahead behind closed doors and they still mutilate girls. And so to be able to institute processes whereby there can be accountability for such things when they are done, and then girls can be safe, we can create safe spaces for girls to ensure that there are places to report to if they know that they run at a risk of being mutilated. This number is high. The absolute number of having 1 out of 10 mutilated person in the world being Nigerian, it's huge. And it is sad. The northern part of Nigeria actually ranks pretty low in the practice of female genital mutilation. And by low, I mean the prevalence rate in the north is just a paltry 6%. In the southwestern Nigeria, according to the recent figure by UNICEF, it is 30% prevalence rate. Now, when you go to the east, the southeast, we have 35% prevalence rate. Now, the southeastern just took over from the southwestern Nigeria. It used to be the southwestern Nigeria with the highest prevalence of this. And I talk of the local government with the highest absolute prevalence of female genital mutilation in Nigeria, which is the Kajola local government area of Oyo State. And this place was where I based my documentary, Don't Cut Her, on, to be able to educate the people on what the practice is to the people and why it may be a bit difficult for them to abandon it, in spite of the fact that the government has campaigned, agencies, CSOs, advocates, and what have you are working pretty hard. I give you, for example, the Rural People Development Initiative, RUPEDIN, that is right there in Isemile, that advocates largely to ensure that this practice stops in that place. But what you find is that in spite of the declaration against the practice, this still festers, because indeed women have now constituted themselves into what I would call a cult of enforcers of this patriarchal act in our society. And largely, how would we end it? Just this way, by talking about it, by educating people about it. I used to be very angry about it until I understood that I needed to do something about it. I needed to provide adequate information to the people so that what they now understand, they're able to fight against. I found that what people do not know, what they don't understand, they can't take a stand for or against. My take-home message to every woman is to please ensure that they know their status down there. You need to know if you have a clitoris or not. I think this helps in this fight against female genital mutilation. When you do know, it gives you enough reason to seek to understand why you were caught or why you weren't. And indeed, you're then able to empower the next generation of girls that we're going to have. Know your status. Are you caught? Are you not? What really is female genital mutilation, and how does it impact you?
Well, it's what happened in Ogbomoso people, which they need more education of it. Although we need education too, yeah. For some of us that are Lagosians today, they came from that ashes. To change from their normal culture is very difficult. I have witnessed something, they transport their female to their village to do it for them. That means we need more education to educate our people that female mutilation is not good.
Yes, sir. There has been campaign against it, and in some local government areas in Nigeria, particularly in Lagos, they have recorded tremendous shifts in the mindset of people as regards female genital mutilation. And I'm sure programs like this taking place in Ewedu would also have a positive effect on the way people see female genital mutilation and the reasons why it needs to be eradicated. To speak with parents as regards female genital mutilation in the area of giving their children the right education. The reason why they are practicing this act of mutilating the genitals of their female children is because they believe it will stop them from being promiscuous. But I want to tell them categorically that they have left what they are supposed to do and they are doing what they are not supposed to do. What a girl child needs is the right education from the right source, not arming them and infringing their fundamental human rights.
We wanted something for grassroots women and Yoruba women in the slum to have knowledge about FGM and then the implications of FGM. So now that the people are here, we are here to educate them, and then now that they know, they should inform the other people and then discourage the act.
They have right to enjoy their lives. They have right to enjoy sexuality if it has to be. And we don't want them to be feeling pains. We don't want them to be sick because there are so many infections that is occurring through this FGM. And it is against this that we have come here today at Ikorodu West in conjunction with National Youth Council, Ikorodu Local Government West, and other NGOs, and Melanie Ishola Foundation, and FIDA, that we are joined together to come and speak against female genital mutilation.
Beyond being a violation of female rights, female genital mutilation can also lead to complications like bleeding, bacterial infection, urine retention, and other urinary problems, damage to nearby genital tissues, severe pain, infertility, and increased risk of newborn deaths.
Make people to understand that it's happening. There's no need to be denying it that it's happening. And we have to educate them. Like we have students here today. We want them to know the health implication. We want them to know that it is not good. We want to tell them that it is not good. And we have to advise, we have to counsel, we have to educate that what is happening, it's a myth. The reason adduced for female genital mutilation is myth. We just accept it. It's just tradition that we just accepted and that we should stop it. The parents too should be aware that the FGM is not good and it's not acceptable. And for the fact that they have done it for you, which does not mean that you should have to do it for your daughters or for your women. So we should stop it. And we should even stop any type of GBV, that is gender-based violence. We should stop it.
Welcome back. Stillbirth is the death or loss of a baby before or during delivery, though both stillbirth and miscarriage are described as pregnancy loss, but they differ according to when the loss occurs. A stillbirth is when a fetus dies after the mother's 20th week of pregnancy. The baby may have died weeks or hours before labor or during labor. Whichever time it occurs, it can be a very painful experience for a mother to carry a pregnancy for months, shop for baby items with great expectations, and then come back from the hospital empty-handed without a baby. I spoke with a consultant gynecologist, Dr. Celestine, Chukunenye about the causes, signs, and how to prevent a stillbirth.
Well, stillbirth is a topic that I have always been very much interested in, and that was what I studied for my fellowship, final fellowship dissertation was on stillbirth. It's a very harrowing experience for a woman to carry pregnancy for many months, sometimes up to 9-10 months, and then go home from the hospital empty-handed. It's one of the most terrible feelings anybody can pass through. Stillbirth is described as when a fetus that has attained the age of viability is delivered without life. It's classified into two varieties. Those that died in the womb before the onset of labor, and those are macerated stillbirths. As they come out, the skin is already peeling off. Sometimes even the muscles are already decaying and all that. And those that happen shortly before the delivery, either during the process of labor or during the process of the emergency cesarean-section, that's when the baby loses its life. Those are classified as fresh stillbirth. And it has just happened usually less than 12 hours at the time of delivery. Either way, it's a very harrowing experience.
So, sir, what are the causes of stillbirth?
And the causes are numerous. For those that suffered macerated stillbirths, one of the most important factors is access and use of antenatal care. Access and use of antenatal care. For some, it's also related to pre-pregnancy care, which is something that is not common in this our part of the world. There is what is called pre-pregnancy care, whereby a couple will approach a pre-pregnancy care clinic and they are checked thoroughly to see if there are any issues that may affectly adverse a pregnancy. And if they are corrected or eliminated before the couple goes on to achieve pregnancy. Now, like I said, it's not popular here. So a lot of people feel, oh, they can just get pregnant anytime they want. And sometimes there may be some viruses, like the herpes virus lurking. Sometimes there may be some bacterial infections in the genital area of both the man or the wife or both of them. And these things can create problems for the pregnancy when it is achieved. Sometimes it may be genetic problems, either in the man or the wife or both. And when we talk about genetic factors, yes, part of it will be the blood group incompatibilities. We have the ABO blood group, we have the rhesus blood group, and so many other minor blood groups. They can affect the outcome of a pregnancy, especially when there is incompatibility between the man and the wife. So these are things that can be detected in a pre-pregnancy clinic, and then the woman can be prepared so that she can go through pregnancy without having much hassles or losing the baby. But other genetic factors will include things like Down syndrome, Klinefelter, syndrome and some other rarer conditions that lead to in utero fetal death, all that. Diabetes is an endocrine pathology. It's due to the pancreas not being able to function very well. The islet cells of let them not go too much into the biology. A certain part of the pancreas that produces what we call insulin in the human body is either about to be exhausted or is already exhausted. And so the patient can no longer handle glucose metabolism or carbohydrate metabolism properly in our body. And the stress of pregnancy tends to bring this on. That's why we see gestational diabetes. If the woman is not pregnant, she runs more or less normal blood sugar levels. But once she becomes pregnant, the stress of that pregnancy makes her sugar levels to go very high. And very high sugar levels can make the babies to grow so big, can outstrip the ability of the placenta to support them, and they can also induce some what we call electrolyte abnormalities, potassium abnormalities, sodium abnormalities, trace elements. They can go so wrong and the baby can suddenly die in the womb. And of course, they are also prone to infection. So that's the second thing. The third main factor is access to good obstetric services, i.e. when the woman falls into labor, how close is the delivery suite to her home? Was the means of transportation to the delivery suite? How soon or how well equipped and on standby is the delivery suite? When she gets there, does she meet all the level of officers that she require? Or in some places you get to a maternity unit, or you only see the orderly. Sometimes you see the orderly, maybe a junior nurse who can't do much. Now, if that woman has come in and there is a serious problem already ongoing, before a senior nurse who may have an idea or a doctor who may have an idea will get to see her, things may have gone on to extremes. Those are the other issues that cause what we call primary delays. But you see, I look at that as more as a function of ignorance, function of poverty. That generally has continued to increase in our environment, and I think it's partly maybe due to nutritional factors and partly due to environmental factors. We have so much pollution in our environment now.
Then, are there symptoms to watch out for? Are there some things that a pregnant mother will notice to know, okay, there's something wrong, let me seek medical help or something?
Yes, what in most cases women may notice is a slowing down of the movements and the kicks they experience while the baby is in the womb. There can be a slowing down. Sometimes it may be a very violent and vigorous movement suddenly. Then you know that the baby is in trouble and the woman should quickly rush to the hospital. Oftentimes when there is this violent movement, it's usually associated with some form of umbilical cord accident, so that the baby is suddenly cut off from the source of oxygen and nutrients, and the baby goes into violent movements, trying to survive. But of course, if the help is not forthcoming on time, it will then give up. So if a woman experiences very violent movements, unusual movements, it's important for her to immediately go to the hospital where she's registered so that she can be checked. And there may still be a chance to save that baby if it's already matured. The other one is if she notices that the baby is no longer as active as it used to be, she should complain to her doctor. And following adequate checks, that can be detected and managed, and if need be, earlier delivery arranged so that the pediatrician can continue to look after the baby in the incubator. So those things are feasible and are possible. The other thing we need to talk about that causes these fetal deaths and maybe late abortions, sometimes early abortions in this environment, is malaria. Severe malaria has been associated with this condition of stillbirth in this environment.
How can people prevent stillbirth? What can people do to prevent it?
It's part of good antenatal care to give women prophylaxis against malaria. And when they exhibit any symptoms that suggest they may have malaria, or a blood test to be carried out to confirm if they have the malaria, and if they do, for the malaria to be adequately treated. There is need for us to make sure that delivery suits at the primary, secondary, and tertiary levels are fully equipped and ready on standby to attend to any pregnant woman that may come in labor with any kind of complications. And there is also need to have, at the lower levels, good and standby ambulance services that can immediately evacuate such women to higher care levels, either from primary to secondary or secondary to tertiary, or that can quickly get the relevant needed staff to assist the woman. These are things that in many of our delivery suites are not readily available. Oh, you need the doctor to come and quickly review the woman. The doctor is leaving 10 minutes from the hospital, but there is no way of reaching him. There is no vehicle to go and pick him up. There's trouble. The doctor is there in his house, but has not been told that anything is happening in the hospital. So there is need for adequate standby vehicles, ambulances, and service vehicles that can do these runs, so that as soon as the patient gets into the delivery suite, adequate help can come for the patient. Then there is also need to have the ability to do emergency cesarean sections round the clock, either in every delivery suite or at least within 10-30 minutes of every delivery suite. There must be a delivery suite that can quickly do an emergency cesarean section, so that if the need arises in the satellite suite, they can alert that delivery suite and send the patient there, and it can quickly be delivered. That arrangement, again, is not on ground in Nigeria. At least I can talk about this state. I've heard of people queuing up to have cesarean sections in some government hospitals. And while they're on the queue, maybe 5 of them, by the time it gets to the 3rd person, the last 2 have lost their babies, maybe about to lose their lives. So there is need to look for either to improve those hospitals where these things are happening, so that you can have 2, 3, 4, 5 more delivery suites that can do cesarean sections, or, like I've said many times before, to look for nearby private delivery suits that can also do the same thing. The problem there will be costs, because the cost of private delivery is not the same as cost of delivery in government centers. So the state government must be ready to support such a move, so that instead of those women waiting in their delivery suits and dying one after the other, or losing their babies, they can be quickly taken to nearby private centers where the same thing can be done very well and save mother and baby. And then the state can chip in to assist such women. Because if they had the resources in the first instance, they wouldn't go and be queuing up in their hospitals and losing their babies or losing their lives. It's because they are resource poor. But they are citizens. And so the state government cannot, and local governments, they should not turn their eyes. That's their fate. They are entitled to the resources of the state, resources of the local government. And they should be saved at such harrowing point. It's important for women to avail themselves of good antenatal care, which can quickly pick up this kind of thing. And the diabetes can be controlled. And then they can have normal deliveries. Such either counseling or, if it's possible, genetic manipulations can be done, or they may be offered alternative forms of achieving pregnancy so that they don't suffer the harrowing experience of not carrying the baby home. So all these things are available in a properly organized pre-pregnancy care settings.
Thank you very much for coming on the program. We appreciate you. Thank you very much. If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment, an aspect of the program where we'll bring you different fruits, food items, and their nutritional value to enable you make healthy choices.
Jute or salad leaves, popularly called Ewedu among the Yorubas, is a prominent vegetable in West Africa, rich in sustenance, possessing other medical advantages. Ewedu leaf is low in calories, high in vitamins and minerals, an adequate source of fiber, helpful in dealing with weight management, and may also promote intestinal health by helping with bowel movement. Ewedu leaves contains the antioxidant trio of vitamins A, C, and E, which fends off free radicals, thereby protecting the body from degenerative diseases, boosts immunity, and nourishing the body. The leaf is used to prepare the popular Ewedu soup, mostly eaten with amala.
Let's take you to our clinical segment for some health tips.
Number one, stroke is not a death sentence, and you should know that it's preventable as well as treatable, And all that I would advise people, Nigerians, is to ensure that they check their blood pressures always, as much as possible, And then eat healthy foods, lots of vegetables and fruits and all the good diets. Then the people with hypertension should use their drugs, All those things are very important because you should know your numbers. If you know the numbers, you'll be able to know this my blood pressure is going high and all of that, And when you see signs that feels quite abnormal, then such individuals should come to the hospital and then get checked, you understand. It's not until something really drastic happens that you have to report at the hospitals. And then for those who believe that Christ will heal them, you know, whatever faith that they believe in, and they take their relatives to the hospital whenever things happen, I would not say you should not go to church, but the health is different from our faith, you know. So when you come to the hospital and you get well treated, then you can always get your prayers and all the other things. So the church is not the first place to take your relatives to when stroke occurs or whenever you're not even feeling well in every way. Just come to the hospital, get tested, then you know exactly what is wrong and all the treatment that you are required to, you know, take.
On our perception segment, we value your opinion on how to improve human lives and the nation's health sector.
The nation's healthcare cannot be stabilized unless the National Assembly pass a law that no politician in power, nobody in power, should be treated abroad if he fell sick. They shouldn't be putting us in more situation that is not good. Because even to cook a meal now, the cooking gas has gone up. They shouldn't be impoverishing the nation. If actually they are getting the money to develop the nation, we would have seen it. But there's no development going anywhere. So you take from the masses, you give to nobody, and then the masses are dying. See, the government, which is the regulator of the economy, should think well on how to get Nigeria out of deep recession. We are in a deep recession, but we are not accepting it as government. But we are in deep recession. Nothing is cheap anymore. Everything has gone beyond the purchasing power of every ordinary Nigerian.
This is where we wrap up the program today. Please join us same time next week for another wonderful edition of the program. Please advertise your health products and services with us for a good mileage. My name is Oshuomowa Daniels. Please keep staying safe.